Welcome to Mburahati, a neighborhood in Dar es Salaam, Tanzania. Now in Tanzania, an estimated 6% of the population has HIV, but the incidence is higher in urban areas, and urban women are at especially high risk. Their infection rate is believed to be about twice as high as that of rural women, about 11%. Here in Mburahati, a densely populated urban neighborhood, Harvard School of Public Health professor Mark Mitchell equipped community health workers such as Amina Kiloko with mobile devices to assist in HIV care. These simple cell phones have special software that prompts Amina, seen here on the right, with questions to ask. She screens her clients for symptoms of complications from HIV and refers them to a clinic if necessary. We introduced readers to some of these clients in our September-October cover story, but every one of these women had a remarkable story of her own. Amina's first client on the day that I was with her was Awedo Mohammed, who is living with HIV but whose 9-month-old son Khalid is healthy. In these photos, they're meeting at Amina's house. She opens it to her clients for confidentiality, so she doesn't have to be seen going to their houses. Now, Awedo was certain that her husband had given her the virus, and he himself refused to get tested, but she told me that she still believed he was a good husband because he didn't leave her, nor did he ostracize her for getting treatment and taking medication. Next we met Philem and Prim, who you see here dividing detergent powder from an enormous bag into small packages she would resell on the street. This was her business. Her husband had died 3 years earlier. At the time she didn't know whether she was HIV positive, and she waited a year after his death to get tested. But now she was on treatment and was healthy and prosperous. Her house smelled like soap, and she had this radiant smile. The next story was sadder. 27-year-old Mwanaisha told Amina that she had recently learned she was pregnant but had had an abortion. She and her husband, shown here, had a child the previous year, but the baby was born with HIV. Mwanaisha, who makes a living by selling food, learned she had the virus while pregnant, but she was scared to tell her husband, so she skipped doses of her medication because she was afraid he would see her taking it. Meanwhile, her husband, who sells shoes for a living, was also infected and had known for a while he'd gotten sick enough to be on antiretroviral therapy, but had never told her. Their child didn't survive. And now Mwanaisha said that when she learned of the new pregnancy, she was coerced into having an abortion. She said she was told at the clinic, if you didn't take care of your first child, why would you take care of this one? This detail is puzzling because abortion is illegal in most circumstances in Tanzania, but at any rate, this couple had a heartbreaking story. All the same, as Amina told them, they were young and had time to try for another child. Amina told me that she started this work because her own brother had died of AIDS, and when she sees the way her work helps these women, and the way they have pulled together to help each other, that's what gets her through the difficult moments